Moving along in our bone exam prep, so we've already done a general overview of the entire skeleton and done all of the bones and features you need to know in the cranium or skull. So now we'll continue with our axial skeleton, focusing on the vertebrae. So from below our skull, starting at the base at your first vertebrae and moving down with all your vertebrae. So for your vertebrae, you're not going to have to know the different, which one. So not like if you have to know the difference between, your different types of vertebrae, such as, not types of vertebrae, but your different numbers of vertebrae. So if I put 2 cervical vertebrae down there, you won't have to tell me, oh, that one's C7, but that one is C2. But for the vertebrae, you will have to know them by their shape size. So the first one up here is the cervical vertebrae. There are 7 of them. So with your cervical vertebrae, your spinal cord is exiting out of your foramen magnum at the base of the skull on the occipital bone and is passing through the middle of your vertebrae. So as your spinal cord moves down your vertebrae, it thins out a bit, enlarges a bit for the nerves for your arms, then thins out again, enlarges a bit for the nerves for your lower limbs, and then separates out into multiple nerves at the sacrum near the end. So starting with our cervical vertebrae, these are the vertebrae in the neck. There are 7 of those. For your cervical vertebrae, so again, having a large hole here in the center, making room for the spinal cord, as well as the 2 smaller holes on the side for the cerebral arteries. For your, for the cervical vertebrae also, they have, unfortunately this is a bad example of one, but they have this last spinal part. So here is the back portion. This is bifurcated or split into 2. Again, this is a bad example. I think it just got broken off. Oh well. Another feature for your cervical vertebrae, the base or the body of that vertebrae is small because there's not much weight sitting on top of it. There are 2 cervical vertebrae that you're going to have to know. So that's your C1 cervical vertebrae. That looks quite different, as well as your C2. So your C1 cervical vertebrae is called the atlas. C2 is your axis. Your atlas looks like Yoda's head. So if you think here's his face, and then these 2 sides here are the ears. So again, same thing like the rest of your cervical vertebrae. Big open space for our spinal cord. We have these condyle surfaces here where your skull will sit on top of it and allows for, of course it's a little cheap skull, but allows for your head to rock back and forth. And then of course space for the cerebral arteries to pass through. So again, our atlas looks like Yoda's head. So study you must, pass you will. Okay, the second one that's below it is called the axis. So this one has a little knob on top of it. So if we lay this out flat, here's a little knob at the top of it, the dens. So again, big hole here, except for we don't have those little holes on the side. This one runs in the middle of your atlas, so like a axis, like the middle part of our skeleton running through our body. So the atlas sits on top of there, axis, the little knob or the dens of our C2 vertebrae fits right in the middle of that. So that allows our head to turn left and right. One way of trying to remember which one's which. So not only do we have Yoda's head for the atlas, also for the atlas, if you know your Greek or Roman mythology, there's someone who has to literally hold the world on his shoulders. So if this were the Atlas's shoulders, so that's the guy's name, and our skull is the world, then it sits right on top of that. All right, moving down into our chest region for our thoracic vertebrae. So our thoracic vertebrae will also make a articulation or a joint with the ribs. So for our thoracic vertebrae, again looking from the back region, so this is the front, we have a little bit larger base body for the thoracic vertebrae because there's more weight sitting on top of it. On the sides, having the more the costal surfaces for the joint with the ribs. And then what's different about the spine, so it's not bifurcated like your cervical vertebrae, so it's only one piece, so it doesn't split. Your angle of that is actually significantly downward. So pulling back our cervical vertebrae, here, not much of a downward angle for the cervical one, but more significant, do it this way, more significant downward angle for your thoracic vertebrae. So there's 12 of those. And one way to easily tell which one is the thoracic vertebrae is that it looks like a giraffe's head. So here's the head, there's the nose, ears, and those little knobby things on top of the giraffe's head. Last one is your lumbar vertebrae. There's 5 of those. So your lumbar vertebrae being at the lower back, again, holding even more weight on top of it. So its base is going to be pretty thick. The hole here is just your plastic molding hole. So thick base, hold weight. With your lumbar vertebrae, the spine at the back, instead of being angled down like your thoracic vertebrae, it goes back straight out. These facets here keep your lower back from twisting. So the next vertebrae here, so these little extensions down here, you're going to fit there. It's in the one on top. And it prevents your lower back from twisting. So you can't move your lower back twisted around. One way to identify your lumbar vertebrae is that they look like a moose head. So from the side, we have the antlers. Then we have that big snout that they have as well for our moose. Okay. Last 2 pieces on our vertebrae. So in an adult skeleton, these last 2 pieces are bones that have been fused together. So multiple bones fusing into the sacrum, as well as fusing into the coccyx. So for your sacrum, So here we have some lumbar vertebrae here, and then this triangular piece is the sacrum. For your sacrum, it forms an articulation or a joint with your os coxa or your hip bone. So this also, the holes here allow for spinal nerves to exit out. So we have our spinal cord where my finger is, and then it goes into your sacrum, and then the spinal cords exit out through those holes. Again, this is a fused bone that fuses together in an adult. And then below it, this little tiny piece off of here, another fused bone called your coccyx. Common name for that one is your tailbone. So that's one of the areas where you have variation in bone number between people on how many bones fuse together to form your coccyx. So in all, there are 26 vertebrae, and yes, you need to know that number for the test. It'd also be very nice to know that you have 7 cervical, 12 thoracic, and 5 lumbar. It's something that you're definitely going to want to know as you're doing your test. Hint, hint. Okay, so sacrum, coccyx, done with those. Keep going. Okay, so we've done with our axial skeleton. Now moving on to our appendicular skeleton, starting with the arms. Never mind. Forgot the biggest piece on the axial skeleton, so that is your rib cage area. So in the middle of your chest, helping to protect your heart, is your sternum. So your sternum has 3 different pieces. your manubrium, which is this upper piece here, so kind of like the knot on a tie. Your xiphoid process, which is at the bottom, so when you're giving CPR to a person, this is the part that is most likely going to possibly break off. And then the middle part is your body or your gladiolus. So that's this kind of middle tie section of the sternum. With your sternum, it makes cartilaginous joints, so joints made of cartilage to your ribs. Let's pull that into view. So here's our sternum down the middle, our cartilage joints, making them with our different ribs. So speaking of the ribs, there are 12 ribs in total. Those 12 ribs will wrap around the chest and will make an articulation or a joint with your 12 thoracic vertebrae. Oh, what was that? Oh, well. So your 12 ribs, the first 7 are called true ribs because they have their own individual connection with your sternum. So here, this cartilaginous joint, so 1, 2, 3, 4, 5, 6, 7, all are considered true ribs because they have their own individual joint to the sternum. The last 5, so that's your 8, 9, 10, and not pictured, I should put it here, is your 11 and 12, so the last 5. So these last 2 floating ribs here. Because they don't have their own individual connection to the sternum, they're called your false ribs. So the first 3 makes a cartilaginous joint with the cartilage from that last true rib. And then the last 2 of your false ribs, numbers 11 and 12, they don't have any connecting joint to your sternum. So those here are your false ribs there. So 11 and 12. Okay, false ribs, floating ribs, 12 ribs total. Need to know that for the test. So on your rib structure, here we have our curved rib. This head portion attaches to the vertebrae in the back. And then it curves around. This is your shaft portion to eventually make that cartilaginous joint to the sternum. So head near the more curved region, and this longer, more straighter portion is the shaft. Okay, now we can move on to the appendicular skeleton. So starting with the arm, in order to attach the arm to the body, it's done so through the pectoral girdle. So inside, or in the front of your pectoral girdle, you have your clavicle here. And also attaching it to the back is the scapula. So showing a better version of your clavicle. So it's an S-shaped bone. So looking from the top, S-shaped. It is also flat. So for the test, you just have to be able to identify that this bone is the clavicle. So on the back is the scapula. So kind of this triangular shaped bone. You do have to be able to know the difference between left and right. So here's our little kind of reference skeleton here. So if we're looking, this actually should go in the back this way. Looking at our skeleton and which way is it going, thinking the socket portion here, called the acromion, that's going to point out, so your arm's going to attach to this side. This big spine portion here is going to point towards the back. This part here is your medial edge, so going to point towards the middle portion of the body. So like our skeleton here. So this would be a right scapula. So again, you have to be able to label left from right for this bone. Oops. Okay. Other features for this bone, you have the acromion process. So it extends off from the spine. So spine here. Acromion process curving towards the front of the person. And in the front of that is your coracoid process. So facing kind of the surface of the person. So one way to remember which one's the acromion process and which one is your coracoid process. The acromion process, if you look at it from the side, is slightly higher. So thinking of your alphabet starting with A and then moving down to C. So A comes first, then C. So this one's the acromion one. So again, this is the spine. You need to know that. Glenoid cavity is where your arm socket is. So where your bones from your arm attach to, that makes that joint there. Okay, so the bone that makes that joint is your humerus. And that's this bone here. So the head of your humerus is going to fit right into this socket. So just like that. So it's actually a very shallow socket and able to have, all kinds of wide range of movement. On the humerus, you will have to be able to tell the difference between left and right as well. So the way to do that is look at the bottom part of your, or more inferior part of your humerus. There's this very large divot in the back of it. That's where your next bone that we'll talk about fits to make a joint there. But this one major divot goes to the back. And then your head is going to fit into the socket on the scapula. So unfortunately, I got the wrong side of the scapula, but it's okay. So this goes into the scapula, our head portion. This goes to the back. So able to tell our left from our right. So if this is going into the body, this is in the back. So that means that this is attaching on the left side. The features that you have to know on the humerus. So going back to our anterior view. So this is on the back side. So we're going to flip this. Going to our anterior view at the top near the head, we have our greater and lesser tubercles. So this one, thinking, of course, this is actually a little bit larger than this smaller, lesser tubercle. But another way to remember that this one is higher in height than your lesser tubercle. So keeping that separated. So greater tubercle, lesser tubercle. Down below it, there's a deltoid tuberosity. So tuberosity is a rough surface. So you're actually able to feel that on the plastic bones. And that's on your shaft region. Then all the way down to the bottom, still in our anterior view, we have our medial and lateral epicondyles. For your medial and lateral epicondyles, remembering which one's left and right. So we're going to flip this as if we are looking at it from the back, going left and right. So if this is going into our shoulder, so left here, then this is pointing towards the middle portion of the body. This is pointing towards the outer lateral side. So our medial and lateral epicondyles. Last three features, you have your trochlear, which again, anterior view, that's on this more lateral side. Yes, lateral side with our lateral epicondyle. So here, kind of a little bit more faced out towards you. Then the other one is your capitulum. That's this little smaller one right here. So kind of more pointing down for its curved surface. Okay, correction. So for your humerus, so we're looking at our posterior side. So here's our little big divot on the back. So that way it gives us our orientation on which side is going towards the body, which one side is going out the body. So on our lateral side, we have again our lateral epicondyle. And on that side is your capitulum there, so the one that actually points forward. This side is the trochlear, the one that points more downward. And then this is our medial epicondyle, the big one that's sticking out. So medial and, is there any way to try to remember how this goes? I don't know. I guess you go like MT for like a med tech. I don't know if that might help someone, but medial side has your trochlear side. Okay, so moving on. So this is our upper arm region. So moving from the humerus down to the radius and ulna in our forearm. So I'm going to skip the carpals and go back up to go to the radius and ulna and come back to those later. For your radius, so your radius doesn't have too many features. It does have these features that it does stick out, where it kind of gives you the notice that that is your radius. So we have this flat side of the head on top here, so like a disc. And then you have the radial tuberosity, so this rough surface that kind of points out on this side of the radius. Remembering that your radius is on your thumb side, so something is rad or cool or something you like. So those are your features for your radius. So that pretty much not much you need to know for that one. For your ulna, so again, your ulna is on your pinky side. For your ulna, you will have to know the difference from the left and the right. So for your ulna, it has a U in the head side of, it is not on the head side. Okay, let's try this again. So I actually got this from a student who combined everything and unleashed into one study guide. But they did make a very high grade on the test. Okay, so going back to our ulna has a U on the elbow joint side. So with your humerus in that little back dent that I told you about to determine which side's the anterior or posterior side, that little U is going to make that hook and form your elbow joint. So that little bump called the ulnar process is where you have your elbow bump to it. So here, making that joint connection there to make your elbow joint there. So this is where your this bone actually slides and makes a connection with that trochlear on this side of your humerus. So big U, that's your ulna. So in order to determine your left versus your right for your ulna, on your lab table, you'll be able to do this during the middle of the test. So the instructions on your study guide say to lay your hand palm side up on the table. And then you're going to place your ulnar process upward on the table. So on your ulna, your ulnar process is going to be the one that has the larger scoop to it. So thinking kind of like, okay, this one has the larger amount of ice cream I can get out of there. Versus on the other side is your trochlear notch, so a lot smaller portion size on this side. So ulnar process here, there's your big scoop there, so it's going to lay up top. Then lay it next to the arm with the head of the ulna pointing away from you. So the head of the ulna is actually at this little smaller end, so we're going to point this away. And the styloid process of the ulna is on the same side as your pinky. So if I did with my right hand here, the pinky and my styloid process of my ulna are not on the same side. So this ulna is the left ulna. So pinky's going to be on the same side as the styloid process for your ulna, as long as you have your ulnar process sitting up towards you. Hands are palm side up. Let's see. At the same time, pinky. Okay, we're good. Moving down the arm, so we've talked about our forearm region with our radius and ulna. Now moving to our hand region. So with our hand having multiple pieces, we have our carpals, our metacarpals, and our phalanges on the hand. So I'm going to go back up to our carpals. So your carpal bones actually have individual names for them. For your exam, you're only going to need to know one carpal bone. So that one bone that you need to know is the pisiform. So on your hand, this is a left hand. Near your pinky side, this little bone here that's sticking up above, kind of like the rest of them. Let's see if I can get a good view for there. There you go. So this one that's sticking up above that one is your pisiform. So that's the one that you're going to need to know. For the rest of your bones, they actually have a fairly simple naming system. So with your metacarpals, starting from your thumb, so those that took French and maybe Spanish, they did this too, where you start counting with your thumb. So thumb, those bones are going to have the number 1 as part of their naming system. Index finger, 2. Technically your middle finger, 3. Ring finger, 4. Pinky finger, 5. So 1, 2, 3, 4, 5. So this first set of bones, so all these are carpals, so we're going to ignore those. This first set of bones are called your metacarpals. So think like carpal tunnel syndrome, which one's which. So carpals and metacarpals. So this one would be metacarpal 1. This one would be metacarpal 2, 3, 4, and 5. For your phalanges, still keeping the same numbering system, but also distinguishing between which one is which based on how far away they are. So for example, in your thumb, only having 2 phalanges, or at least phalange bones. So this would be your proximal phalange number 1, your distal phalange number 1. Moving over, let's go to the middle finger. So we have our proximal phalange number 3, our medial or middle phalange number 3, and our distal phalange number 3. So same numbering system, 4, 5, 2 for each finger. So still, finger has that same name, and then based on the distance for them. Okay, so next video I will finish up with the appendicular skeleton, focusing on the legs.